Hi, my name's Tara Faulkner. I'm going to do my head-to-toe exam. This is my sheet. It is blank. The back is blank. So I'm going to begin.
Man,
Hi, my name's Tara. I'm going to be your nurse today. I'm going to be conducting a head-to-toe exam. Can you tell me your name?
Connor Barrier.
All right. Can I call you Connor?
Yeah.
Okay, Connor. Can you tell me where you are?
Sitting on the couch in my house.
Okay. Can you tell me what time of day it is?
It's in the evening time around 7:30, 7:45ish.
Okay. You are alert and oriented times 3. So I'm going to take your blood pressure on your right arm. So yes, let's put that under your arm. And the reason for that is so that your heart is level to where we're taking your blood pressure. Okay, your blood pressure is 101/60. We'll move this to the side. Okay, next I'm going to check your eyes and face. All right, can you pull your hair to the side for me? Perfect. Okay, so your eyebrows look symmetrical. Your eyelashes are full. I don't see any missing eyelashes. So looking at your pupils, they look to be about 3. So I am going to check to see if your pupils constrict evenly. They do, so when I shine the light in both eyes, your pupils constrict equally on both sides. So I'm gonna check your accommodation. So if you could look out to the side, or there, I'm gonna pull this into your line of sight. And if you could just focus on this now. Okay, very good. So your accommodation's good. Your eyes focus at the same time. Now I'm going to check your ears. We'll start on your right side. So looking at your ear, I don't see any deformities. The color seems to be even, pink, tan, no lesions or any kind of internal ear discharge. Could you turn and face me this way? Okay. So this ear appears to be the same. So there is no deformities, no lesions. The ear is symmetrical, pink, warm, both ears. Temperature is the same. And I don't see any inner ear discharge. So your ears are good. If you want to turn back around. All right. I am going to look at your lips. They look pink, moist, and symmetrical as well. If you could open your mouth very wide for me. Okay. Looking at the teeth, I don't see any cavities. The cheeks, tongue, and palate are all pink and moist. If I could see a pearly, toothy smile. All right, all of your teeth are intact. When you had your mouth open, I didn't see any dental caries. Your gums are nice, moist, and pink as well. All right, now I'm going to check your trachea. So I just want to make sure that your trachea is midline, and it is. I'm going to check your skin turgor here. All right, that is very brisk. It snaps right back into place. If I could have you lay back for just a second, I'm going to check for jugular vein distension. And from this view at about 45 degrees, I do not see any jugular vein distension. So that's very good. Okay, now if you don't care to pull the sleeves up on your arms, okay, and if you could hold your arms out like this, okay, very good. So by looking at your arms, I can see that the skin is the same color gradient, no changes. Your skin is even in temperature and warm and dry. I don't see any lesions, bug bites. There are a few little scratches here on your arms, but they don't look infected. They look like they're healing up very easily. While I'm here, I'm going to check your radial pulses. They are equal and strong, and I would say that those are about 2+. Now, if you could turn your arms this way. Okay, I'm going to check the same thing. Okay, very good. Skin is smooth. Color is uniform, pink, dry. No lesions, no bug bites, no kind of bruising or anything like that. Next, I'm going to check your hands. So your hands look nice and smooth, regular, no deformities, no bug bites, anything like that. Your nail beds all look good. All of your nails are in place. They are connected to the nail bed. Your fingernails are round, no clubbing is noted, and capillary refill is less than 3 seconds on that hand. And I see the same thing on this hand. Again, no clubbing of the fingernails. The fingernails are nice and smooth, they're round, they're nice, clean, well taken care of. Nails are attached to the nail beds. Your capillary refill, again, is brisk and less than 3 seconds. So that's very good. Next, I'm going to move on to your legs. I'm going to use this pillow because this floor is hard as a rock. Okay. So looking at your legs, I don't see any lesions, no deformities, no bug bites, lacerations, anything like that. The skin is uniform in color, texture, and temperature. So I am going to check for your pedal pulses. And they are equal, strong, and I would call that +2. Again, the toenails are the same as the fingernails. They're groomed well, they're round. Capillary refill is brisk, +3. If you could put your hands, or your feet into my hands and press down like a pedal. Okay, very good. Now, if you could press against, okay, very good. You can put your feet down. I would say that strength is +5. Okay. So next we're going to check to make sure that you don't have any edema in your legs. So I'm going to put pressure on your legs for 5 seconds. And this is pretibial edema check. Okay, and there is no pitting. So that would be 0. You do not have any edema in your legs.
Okay.
All right, now, if I could have you go ahead and sit back, we're gonna start with your respiratory exam. So if you could take a nice big deep breath for me. Okay, chest rise and fall is equal and symmetrical. So what I need to do now is listen to your breath sounds. So however you're comfortable, I can grab you a blanket so you can have privacy, or you can take your shirt off, just whatever you prefer.
Okay.
Okay, so I'm gonna listen to 6 to 8 areas on the front and then 8 areas on the back. Okay, so when I put my stethoscope on your chest, if you could just take a deep breath for me. If you get winded, let me know and we can take a little break. Okay, and then I'm going to listen under your right arm here. Big deep breath. Okay, thank you. Now I'm going to have you turn and face that wall, and I'm going to do the back. Okay, again, just big deep breaths when I put my stethoscope to your back. Okay, very good. All right, you can turn back around. So, during that assessment, I found that your breath sounds are even and present. You don't have any rattles, rhonchi, any kind of stridor. You don't have any adventitious breath sounds. Your breath sounds are vesicular, and they were regular in rate. So next we're going to move on to your cardiac exam. So if you want to go ahead and lay back and get comfortable. Okay, so what I'm going to do is I'm going to be checking 5 different areas for your cardiac exam. So first of all, I am going to check your aortic area, your pulmonic area. This is called Erb's point. We're going to move down to, well, it's more here, and then to the tricuspid area, and then we're going to move over here to this side to the mitral area. Okay, so I just wanted you to know those terms. I'm going to be listening with the diaphragm of my stethoscope and with the bell. Once I go through with the diaphragm, we're going to listen with the bell. It's going to take 60 seconds, and I'm going to get count your heart rate. Okay, so if you have any questions, let me know, but this will take a couple of minutes to complete. first of all, this is the right second intercostal space, right sternal border. This is the second intercostal space, left sternal border. Third intercostal space, left sternal border. Fourth intercostal space, left sternal border. This is the fifth intercostal space, left midclavicular line. Okay. All of that was, heart rate is equal, regular. I didn't hear any murmurs, any rubs, anything like that. While I've got this out, before we do the other, I'm gonna look across your chest. I don't see any heaves or lifts. So now I'm gonna go back the same way I started with the bell of my stethoscope. Okay, and we're gonna count in this area for a full 60 seconds. Do you have your watch? Okay, and we are going to go now. Okay, that was 56. Now, and that was taken at the left midclavicular line at the fifth intercostal space. Now I'm going to go back, and this is the fourth left clavicular line at the, okay, fourth intercostal space, left clavicular line. Sternal border, left sternal border. Third intercostal space, left sternal border. Second intercostal space, left sternal border. Second intercostal space, right sternal border. Okay, so as far as that goes, you didn't have any murmurs, you didn't have any rubs. Your heart rate was regular at 56. Okay, and I did already check your jugular vein distension, didn't I? Yes, no, I don't know. Let's check it again since you're laying here. Okay, I do not see any jugular vein distension here. Okay, we're gonna do your abdominal exam. So we're gonna check 4 different areas, and then I'm going to put some pressure on your stomach. Before I start, are you having any abdominal pain at all?
No.
Okay. All right. your abdominal sounds are present and they are normoactive, which means they're perfectly normal. There's not too many, not too few. Now I'm just going to put some pressure on your stomach. If you feel any discomfort while I'm doing that, please let me know. Any pain? No? Now I'm going to put a little bit of deep pressure on your stomach so that I can check your organs. Okay, any discomfort there? Okay, so no tenderness. I did not feel any masses. I didn't feel any swelling. I didn't feel any organ megaly, and you denied any kind of abdominal discomfort. So that is very good also. To conclude our head to toe assessment, I'm going to do a spinal exam. So if you could stand up for me. Okay, if you could just face that wall there. Okay, I'm just going to palpate down your spine. Just let me know if you have any discomfort. Okay, any pain at all there?
No.
Okay, and put your head straight for me. Your spine is nice and straight. If you could bend over slightly for me. Okay, yes, spine is straight. I don't see any signs of kyphosis, lordosis, or scoliosis. And since I have you standing this way, I'm going to look at your forgot the words. Your posterior and anterior chest, and we'll turn this way, and we're going to compare it here, and it is definitely less than your, oh, the words, it's not transverse, it's your, yeah, yes, okay, it's okay. Anterior to posterior is less than transverse. Okay, so that concludes our head to toe assessment. You were perfect. Do you have any questions at all?
Can I get dressed?
Yes, thank you.